Okay, and you see just the whole screen, not my notes or anything, right?
No,
Yep.
it's good.
Okay,
Good.
all right.
Well, thank you so much, Darlene. I am so excited for you to be here today with us. And thank you, everyone who's joining, listening to the recording live or to the replay. And I want to introduce you to Darlene Cunha. Darlene's presentation is the healing power of presence, restoring humanity in healthcare. Darlene Cunha is a transformative nurse executive and Caritas grounded change coach. Darlene brings over 40 years of leadership in clinical and operational excellence. Her work is rooted in the sacred art of caregiving, guided by loving kindness, dignity, and deep human connection. Having served as Chief Nursing Officer and Chief Operating Officer, Darlene is known for leading complex systems through healing centered transformation. She mentors emerging leaders, stewards innovation with heart, and elevates the human experience across every level of healthcare delivery. During her Caritas presentation, questions are welcome. Please place them in the chat and they will be thoughtfully addressed at the conclusion of the session. Thank you so much for being with us today, Darlene.
Thank you so much for that beautiful introduction and so much gratitude to a loving organization and impact activators for really having me here today to speak at this summit. It's really rare to be in a space so aligned with Caritas. It's, where healing and humanity and bold action really come together. What we're here for is not to fix broken people. We're here to heal broken systems. And that begins with love. Caritas reminds us that people are the purpose. When we restore dignity in caregiving and build systems rooted in compassion, we create spaces of healing, not just for patients, but for one another. Healthcare isn't just tired, it's unwell. But when we pause and shift our attention towards connection, presence, and love, that's love in action. That's Caritas. We begin to heal what truly matters. That shift is where transformation begins. So when you look at this picture, it does look like the future is not visible, but there's light. Healthcare is on a journey, but there's light ahead of us. The power of presence, that healing power of presence, restoring humanity in healthcare. Why this matters. Moral injury is not just burnout. It's the pain of being unable to live our values. And the missing link, it's the culture. And it starts at the top. Caregivers aren't broken, but the systems they work in often are. Hunter Patch Adams became a doctor to heal through human connection. We may remember that movie with Robin Williams. After a revolutionary and groundbreaking emotional breakthrough, he checked himself into a mental institution at the age of 18, where he used humor to connect with fellow patients. He realized that compassion and laughter were powerful tools for healing, and that this experience would then shape a lifelong mission to transform medicine. He was totally disillusioned by the impersonal nature of medical school and institutional healthcare, and he envisioned a radically different model, one that was free and accessible to all, joyful and emotionally present, holistic and community-centered, essentially Caritas. His commitment became a movement. Our work today is to heal those systems from the inside out, just as Dr. Hunter Patch Adams dared to do more than 45 years ago and continues to do today. He will tell you if you treat a disease, you win or you lose. You treat a person and you win every time. So let's talk about the themes we'll discuss today. Caritas in action, from Gene Watson's theory to a framework for organizational healing. Systemic healing, burnout and moral injury are symptoms of deeper disconnection. If you've ever felt this, know you're not alone and it's not your fault. And then, of course, we're going to talk about how we apply this to the SOAP framework for a culture of change. Listen to those emotional truths. Read the vital signs of your unit or your system. Diagnose those root causes and co-create healing interventions. So before we dive in, let's take a moment to reflect. What's one word that captures what you need most from your organization right now? Is it kindness? Is it patience? Go ahead and drop it in the chat. It's a simple way to center yourselves before we begin. Because Caritas is just love made visible, and it's the revolution healthcare needs. So go ahead and drop that in chat. And I will have my dear friend and colleague here, Valerie, watch the chat for me.
Yes. So we have compassion, trust, feeling safe, trust, a lot of trust, as well as.
Yeah, right? What do we need now? Trust, compassion, kindness, patience, love. That's what we're missing. We've become so transactional. We've got to get back to being transformational. So, Patch Adams, let me tell you a little bit about this remarkable man. In the early 1970s, a young doctor named Hunter Patch Adams didn't walk into hospitals with a clipboard. He walked in with a red nose, a wild costume, and a radical question. What if love was the best medicine of all? He didn't just challenge the system, he reimagined it through laughter, presence, and deep human connection. He transformed sterile rooms into sacred spaces of healing. His vision birthed the Gesundheit Institute, where care was free, dignity was non-negotiable, and joy was part of the treatment plan. You see, Patch Adams didn't treat illness, he treated humanity. And in doing so, he embodied the very essence of Caritas, love made visible. From clowning in pediatric wards to holding space for grief, he showed us that healing begins not with procedures, but with presence. Today, as our systems groan under the weight of burnout, turnover, and moral injury, Patch's legacy is a mirror and a call, because what he knew then is what we must reclaim now. Presence heals, and love is not a luxury, it's a necessity. This healthcare summit echoes this truth. My colleagues who went before me, thank you for sharing all the truth. Our systems are not just strained, they're soul sick. Burnout, turnover, and moral injury are not just isolated metrics. They're symptoms of a deeper disconnection from purpose, compassion, and relational trust. Now, I want you to watch this clip. Watching the Patch Adams trailer today will feel almost surreal. Off we go for our next adventure. You just have to get through the... Give me 1 second here. It's our mission here, rigorously and ruthlessly train the humanity out of you and make you into something better. We're going to make doctors out of you. Well, I just believe there's more to being a doctor than memorizing facts about ventricular arteries.
Care what you think I care about my biology, huh?
We're not even going to see a patient until the 3rd year.
You want to become a doctor, we have to learn to treat the patient as well as the disease. That's why we have to dive into people. You have a brilliant mind, and like many brilliant people, you don't necessarily think food supplies you.
So much more convenient thinking of you as an idiot.
Well, ice that just chipped off.
If you want to be a clown, go join the circus. For your own sake, I think you should just lay low for a while. The hospital will cover all of your bills. Any other questions? Patients are opening up to them, correct? They're sharing their dreams, their fantasies. Concentrate on the pain. I'm warning you, stay out of this hospital. What if a doctor becomes emotionally involved with the patient? What is wrong with that? Patients don't need a friend. They need a doctor. My name is Dr. Bill. I'll be your surgeon. Oh, there you are. You're dismissed. So, from this school. They can't prevent me from graduating because of a personality clash, can they? Universal Pictures presents. You're not cut out to be a physician. Our job is improving the quality of life, not just delaying death. The true story of a man who broke every rule. Why am I such a threat to you, sir? Because what you want is for us to get down there on the same level as our patients. And prove their laughter.
Donner, party of 50. Donner, party over here.
Truly is the best medicine.
Hello, Blake.
Robin Williams.
To treat a disease, you win, you lose. You treat a person, I guarantee you win, no matter what the outcome.
Patch Adams.
Wow. Think about that for a moment. We're going to train the humanity out of you. We're not going to get down to the same level of our patients. Doesn't that feel like where we are right now? Here's Robin Williams bursting onto the screen in a clown nose, hugging patients, cracking jokes, and making eye contact. In today's healthcare climate, that kind of presence might trigger a compliance alert, a risk assessment, and probably a mandatory training on professional boundaries. But Patch wasn't following a script. He was following his heart. He didn't ask, "What's your diagnosis?" He asked, "How is your heart?" And while we laugh, there's an ache underneath, because what once felt radical, joy, presence, dignity, is now what so many of us are missing. Patch Adams wasn't just a movie, it was a mirror. He lived Caritas before we had the language for it. Love made visible. And his legacy reminds us the answer isn't more efficiency, it's more humanity. This summit isn't just about fixing workflows, it's about restoring soul. Because if we want to heal healthcare, we have to start by healing how we care. Caritas is love made visible, and it's the revolution healthcare needs. So, why Caritas is essential now? It's love in action. Caritas is not a luxury, it's a necessity. It's the courage to treat the whole person, the body, the mind, and the spirit, in a system often dominated by speed, metrics, technology. It's grounded in Gene Watson's theory of human caring. Caritas restores the heart of healing through presence, empathy, and connection. It's how we heal patients. It's how we heal ourselves. Because moral injury isn't just burnout. It's the pain of being unable to live our values. We need human connection as medicine. We need emotional and spiritual support. We need healing environments. We need caregiver renewal and resilience. Caritas is the courage to keep our hearts open even when they've been bruised or broken. This isn't soft, it's sacred. And Caritas is the antidote. And it's time, folks. Caritas emphasizes treating the whole person, not just the diagnosis, just like Patch Adams. And in today's fast-paced, high-pressure environments, this approach fosters deeper healing and long-term well-being. Patch didn't just wear a clown nose, he wore his heart on his sleeve. And he treated patients with laughter, presence, and radical love. He was living Caritas. He didn't ask for permission to care deeply, he just did it. Today, our systems are fast, they're fragmented, they're fatigued. Emotional and spiritual needs are sidelined. Nurses and physicians are burning out. Patients feel unseen. Caritas brings us back to connection, to dignity, to healing environments that soothe rather than overwhelm. It's not just for patients. It's a lifeline for caregivers. We must choose love, not because it's easy, because it's true. And Patch Adams, 45 years ago, showed us what's possible. Now it's our turn. So why this film? Why now? You may be asking yourself that. Because it still rings true today. As we were talking so beautifully earlier with all the wonderful presentations, we keep talking, but we're not making progress. Patch did this more than 4.5 decades ago, and yet we find ourselves in the same place. Patch Adams and Caritas are the cure we've been ignoring. He didn't just challenge medicine, he humanized it. His radical belief that you treat a person, not just a disease, was prophetic. And the data is clear. The US faces a shortage of up to 3.2 million healthcare workers by 2026. Folks, that's 4 months away. 65% of nurses report high levels of burnout and stress, and only 60% would choose nursing again. Staffing gaps, emotional exhaustion, and administrative overload are eroding quality of care and morale. Caritas restores the heart of healing. It fosters deep, empathetic relationships that promote trust and that emotional safety we talked about. It creates healing environments through presence, calm, and intentional care. It supports caregiver renewal, helping nurses reconnect with the meaning of their work. This isn't soft, it's sacred. Caritas is love in action, and it's the revolution healthcare needs. Let's find the courage to look inward, to soften where we've hardened, and to remember that the heart was never meant to be armor. It was meant to be our compass. Patch Adams and Caritas, they're not so far apart. The 1998 film depicts Hunter Adams' radical approach. Jean Watson did the same. She looked at that holistic care and the shared relevance, advocating for compassion over compliance, inspiring caregivers to be agents of healing, not just technicians. Let's lead like healers and heal like leaders. I ask you to place your hand over your heart. Feel your heart and silently ask yourself, what's one truth your heart wants you to remember about why you chose this work? What's one truth your heart wants you to remember about why you chose this work? That's why we're here. That's why we do this work. That's why we're talking today about revolutionizing our healthcare system and bringing humanity back to this important work. When we heal through compassion and we show our humanity, we can center compassion over compliance and call caregivers to be healers, not just technicians. Love, kindness, and presence aren't extras. They're the foundation. When we lead from that place, we create conditions where real healing can happen for patients and for each other. In a system often reduced to metrics, Caritas calls us back to what matters, connection, dignity, service, love, kindness, and compassion aren't things we hope will show up later. They're where we begin. They're the soil everything meaningful grows from. And let's not forget the power of humor.
That should be. I have a cold. Bit of cold. Bottom's good. Oh, it's good.
The power of humor. It builds trust, softens hierarchy, and reminds us we're human. Shared laughter strengthens teams. It eases stress. It helps us carry the weight of the sacred work. Healing isn't just physical, it's emotional, relational, and deeply, deeply human. So we're going to pause for a moment here. And again, my dear friend and colleague Valerie will be watching chat for me. But I want you to think about something. What's one thing in healthcare that would be funny if it weren't so true? So let me give you an example. The quiet zone here is right next to the code card. Or we spend more time documenting care than delivering it. Can you think about some of the irony that occurs today in healthcare? Take a moment and jot it down in chat. I had a nurse say to me, "We have a wellness committee, Darlene, but no time for lunch." I hear you. Well, the whole music on the phone is "Don't worry, be happy." We treat burnout with more meetings, right? It would be funny if it weren't so true.
You have an elevator separating one big unit. Who sees over the elevator?
There you go. The printer only jams when you're running late for rounds, right?
That the free
Well,
pizza is actually a sign of disaster. No one is getting a break ever.
there you go. Yeah. It would be funny if it weren't so true.
I know. Team meetings, but only the manager speaks.
Oh, another good one. Well, and that leads us here, right? Because sometimes when we're treating our patients or when we're there for each other, we have to remember that this is hard work, but it's sacred work. And sometimes that fear comes out sideways. And why is that important? Because in healthcare, we often meet people at their most vulnerable, right? They're frightened, they're in pain, they're alone. And sometimes that fear comes out sideways with harsh words, dismissive looks, anger that seems misplaced. And it can be tempting to take it personally or respond in kind. But when we pause And we talked about the power of pause earlier today. When we pause, when we truly see beyond the behavior, we begin to notice what's underneath. The weariness in their eyes, the grief they haven't named, the fear they don't know how to voice. When we choose to lead, live, and serve from that place where we're not relying on wishful thinking, we're creating conditions where healing and transformation become possible. This is the heart of Caritas. This is the heart of the Caritas path. To meet the world not with passive hope, but with intentional presence, to embody the very qualities we long to see in others, and to remember that even in the face of uncertainty, we still get to choose how we show up. Remember, they're not fighting us. They're fighting something we can't always see. For me, that patient was a gentleman named Gus, a cantankerous elderly man who taught me to see more than his illness, to look deeper into his soul. And what I found was a frightened man, afraid to die alone. And over the course of 2 weeks, he shifted my entire team's dynamic. So no, I won't meet fear with defensiveness. I will meet it with presence. I will hold steady, not because I'm passive, but because I know that true strength often looks like calm in the face of chaos. In the end, we don't offer what people deserve. We offer what we carry. And in this work, I choose to carry Caritas. I choose to carry love, compassion, and kindness. So I'm asking you, let's lead like healers and heal like leaders. The power of human connection and the SOAP framework. These are the 10 Caritas processes: loving kindness, faith, hope, trust, relationships, healing, allowing that space for forgiveness, problem solving, balance, learning, that healing environment, ministering, and being open to miracles. We cannot keep patching cracks in a foundation that was never built to hold the weight we now carry. Chronic understaffing, as Michelle shared earlier, administrative overload, moral distress that Henrietta shared, and the daily emotional toll borne by caregivers and patients alike. But guess what? We now have the SOAP framework, and these 10 Caritas processes align with that framework. And I'm going to show you how. Building psychological safety at scale, how important it is to honor that lived experience. When we begin with stories and listen to emotional truths, what are people really experiencing? How does it feel to work here? How does it feel to heal here? What's said? What's left unsaid? In the spirit of Caritas, we don't start with metrics. We start with people. We listen to staff skipping meals to keep up, to physicians documenting more than they connect, to patients feeling unseen. These aren't side effects of a busy system. They're the vital signs that reflect a deeper disconnection between our values and our reality. Listening this way with presence and without judgment restores trust. We talked about that as I opened up this discussion today. Trust was the resounding word that you put into chat. It opens space for real dialogue where fear, fatigue, and hope can coexist. And most importantly, it reminds caregivers that they are more than their productivity. They are human beings and they matter. Patch Adams listened beyond symptoms. He saw the person behind the diagnosis. In our systems, we must do the same. We have to treat emotional and relational suffering as sacred data. Burnout, silence, and disconnection are cries for healing. I had a nurse tell me recently, I leave my shift wondering not if I made a difference, but how I got through. A patient's daughter shared, we were grateful for the kindness in the smallest gestures. Those are what helped us feel safe in the chaos. So there is good. So I ask you, how is Caritas showing up or missing in your current work environment? Place that in chat for me. How is Caritas showing up, or how is it missing? You have huddles, team meetings, recognitions. Place it in chat for me.
During tier 1 huddles.
Tier 1 huddles, yes. Tell me something good, right? Sharing something. Start a meeting like that. Start a meeting with, tell me 3 good things, right? What's going on in your life? What's going on in your work? How can we make this easy for you?
A 17-year-old veteran employee fired because the new leader didn't like the way she did her job.
Oh, there's Caritas not at work, right? Because we always have to look for the gem in our colleagues. Are they in the right role? Did we onboard them correctly? Did we sit down to see if there was something deeper going on with that young colleague's life? That psychological safety.
Healthcare staff don't feel safe sharing their stories.
Yeah, psychological safety, right? It's missing. We have to create a culture around that. When we think about our objective system metrics, we assess the system the way we would a patient, right? Holistically. In a Caritas informed system, metrics are not just numbers. They're stories waiting to be understood and responded to with grace and action. We begin with objective data, but don't look at it in isolation. Just as Patch noticed what others missed, we must read our systems holistically. High turnover, increased falls, missed care, missed breaks, poor communication scores, inequities in access, safety lapses. They're not just operational issues, they're signs of systemic disease. Staff retention rates speak to how well we nurture our teams. Patient safety metrics reveal our commitment to protecting those we serve. Think of it like this. If culture is the heart, communication the lungs, workflows the metabolism, strategy the brain, and safety the skin, we must ask, are these systems perfusing well? Is there oxygen where there should be connection? Is there inflammation where there should be safety? Love, kindness, and compassion aren't outcomes we wait for. They're the starting point. They're the soul in which everything meaningful is grown. Metrics without meaning are hollow, but metrics with heart become maps. They help us locate dysfunctions that stories reveal and guide us towards that healing. They show us not just where harm exists, but where hope can be built. So, what's one part of your workday that feels misaligned with your values? Drop it in chat. I'll give you a couple of examples. Compassion versus systemic efficiency. There's a misalignment. You believe in taking time with each patient and listening deeply and being fully present, but the system is prioritizing throughput. short visits, quick discharges, and metrics that reward speed over depth. You feel rushed, morally distressed, like you're failing your patients, even when you're trying to do your best. Does that sound familiar? Do a thumbs up. When we look at assessment, diagnosing the root cause, just as we differentiate acute from chronic illness, we must ask, is this a policy problem, a leadership gap, or a cultural wound? Is it localized or systemic? What's festering beneath the surface? Once we have those stories and the data, we can begin to diagnose. We can examine how well our policies and leadership really embody love, fairness, and flexibility. Where there's misalignment, there is suffering. Staff turnover, patient harm, missed breaks, they're not operational issues. They are signs of what the system is trying to survive. And Patch didn't settle for surface fixes. He asked deeper questions. We must do the same. Are we treating symptoms or healing systems? Uncover what's broken and reveal what's still beautiful. So what does strategic, intentional, compassionate care?
Yeah, you know what? I really feel. Yeah, just long as the patient confirmed their name with me, that's.
So what does strategic love, intentional, compassionate care look like? Well, care team at the bedside, not rushing, not charting, just being and listening with full intention. This is Caritas presence, the sacred pause that says you matter. A team huddle where everyone's voice is heard, not just the nurse leader. She doesn't dominate. She invites, she listens, she affirms. That's Caritas leadership. The caregiver comforting a colleague after a hard shift. No words needed, just a hand on the shoulder, a shared breath. That's Caritas community, the healing that happens between us. Advocating for a patient others have dismissed. Speak truth to power. Don't back down. Caritas courage, the fierce love that protects dignity. And a moment of reflection at the end of the day, quietly remembering the faces that you cared for, honoring the joy and the grief, the humanity. That's the Caritas meaning, the integration of soul and service. And we look at the path to healing. Healing starts with a plan, but it cannot be a top-down prescription. It must be co-created with those who live the reality every day. We identify priorities like restoring trust, improving communication, realigning roles. But when we go further, when we reimagine leader rounding as acts of presence, not performance, we create space for peer support, for storytelling and recovery, not just compliance checklists. Healing priorities include culture change, trust-building routines, and communication redesign. We invite patients, staff, and community members into the process because healing is relational. It isn't about control. It's about co-creation, shifting from managing people to nurturing them, from imposing change to inviting it. We commit to the long, loving work of transformation with metrics, yes, but also with milestones of meaning, because a system that tracks healing must also feel like healing. Patch's interventions were simple. They were a little profound. Spaghetti pools, finger games, bedside presence. Our plans must reflect that spirit. Healing isn't a project, it's a practice. Co-design with your frontline teams, embed those micro moments of care. This is a call to lead with love, to recognize that transformational change happens with every individual at every level, the giver, the receiver, the observer, because love is a business strategy. One person can change a team can change a department, and a department can change an organization. There are pockets of brilliance everywhere. We just need to call them out to change a culture. So, What simple micro caring moment will you add to your workday? How will you start your workday? What will you do differently? Can you think of one thing? Drop it in chat. Sit at eye level with a patient, even for 60 seconds, to signal dignity and respect. Speak up when a policy or workflow harms patient dignity or staff well-being. Humanize your rounds. Ask patients one non-medical question during rounds, like what brings you joy? Or who's someone you miss? A team debrief after a difficult case, that holding space for that emotional processing. Strategic love, narrative listening, gentle truth-telling, a dignifying touch, a hand on a shoulder, modeling that emotional presence. Mentorship with meaning, policy with heart, culture change, using your influence to elevate stories of compassion and love. Start with that Caritas check-in. The shift we need is from fixing to healing. We must stop asking people to carry broken systems. Instead, we must build healed systems, one with clear roles, compassionate leadership, and supportive workflows. A truly human-centered leader doesn't just look at data or outcomes. They notice the exhaustion in the caregiver's eyes, the silence after a team huddle, and the brilliant ideas left unspoken because the culture wasn't safe enough. They don't rush past the warning. They lead in. Leadership grounded in love and moral presence isn't soft. It's the strongest stance we can take. That's how we create cultures where people not only survive, but thrive. And in this time of profound transformation, Caritas offers a sacred lens to assess and realign our systems, to ground them in compassion and justice, to have them echo hope and love, that their voices become sacred. From Gene Watson's original Caritas processes to today's system-level applications, Caritas has evolved from a theory of human caring to a framework for healing entire organizations. It teaches us that presence heals, compassion transforms, and love is not soft, it's strategic. So we're not here just to heal patients, we're here to heal the systems that hold us. And you're not powerless. You are a systems architect, a builder of care environments where love and leadership and intentional design shape every interaction. Now, Patch, he didn't just walk into a room with a nose, because you don't need a red nose to heal a system. You need presence. You need courage. You need love. So I ask you, what will you do differently today? One small act of love you will bring to your team this week. Will you pause to truly listen? Will you choose presence over performance? Will you lead with empathy, even when it's hard? So healing doesn't start with the protocol, it starts with a person. And the smallest gesture, a glance, a touch, a moment of stillness can change everything. Thank you. Thank you for your time and attention. This is how we reclaim the soul of caregiving, one presence, one person, one moment at a time. Thank you for the work that you do, for the way you show up, for believing in what's possible. Let's move forward together with Caritas.
Thank you so much, Darlene, for such an amazing, beautiful, loving presentation. Let's
Thank
open
you.
it up. Thank you so much. Let's open it up for a few minutes on Q&A, and then we'll have a short break for our next session. So if anyone has any questions for Darlene, I will open up the floor for them right now.
Wow, so much love and chat. Thank you. Thank you to my dear colleagues who showed up on this beautiful Saturday. Tom, Fariba, all of you, just Diane, Elizabeth, Brendan, for everyone that showed up. Thank you.
Darlene, the chat is exploding. It's amazing. I guess the I don't know if I have a question, but I'll just say, just hearing you, you're a force of nature. So how does anyone resist this, and why isn't this happening everywhere already? This is incredible. What is your sense of what do we need to do to kind of, overcome the hesitations or the barriers that people may have?
I think people just want to be heard. When, we talked about that earlier with Henrietta, we talked about it with Michelle, we've explored it with our leaders who spoke earlier. People just want to be heard. When we really listen, truly listen with our full heart, we can hear the heaviness, and that's when we can begin to heal. We have to know what the root cause is. It's not about more money, it's not about more equipment or resources. It's about restoring humanity, giving them a reason to connect their heart back to the reason why they joined this beautiful art of human caring. Get them back to the vision and mission of the work that we do. When we do that, people will stay. They want to be part of something that's meaningful. And I think when we do that, we will create an avalanche of love.
Awesome.
Darlene, I'm going to jump in here real quick to say, one of the things that you mentioned is about hearing, like hearing people's stories. And one of the things that I see often, especially with nurses, is they don't feel like they can speak up. They don't feel like anybody's listening to them, and you get into such a negative vibe, and again, it's because there's no trust, there's no love. It's all, us and them against the world and all these things. So there's a lot that goes into even offering them to say, well, you can just tell us your story. But, after working on this since COVID, to try and say to nurses, well, let's just share your story. It's taking time because they don't have that trust. They're just, they just come and do this. And if they're already in burnout, well, then there's all kinds of things going on already. So even just creating that space, and as a coach, that's what you do is I'm just there to hold you and you have the opportunity. But I just see such a need for that because they're not telling their story, and that's unfortunate because that's where transformation starts.
Oh, darling, you're speaking my love language. And it really is about you can't build trust if you don't know who your people are.
Yeah.
You have to have that visibility. You have to round on the floor and not round to say, hi, how are you? But not stick around long enough to see how they really are, right? Those water cooler moments that really matter are when you can connect with your colleagues, connect with your constituents, connect with your patients. Make the time to really listen. I had a nurse say to me one time, I had a CNO before you, Darlene. I didn't even know her name. And I thought, oh my gosh, didn't even know her name, but she said, I didn't even know what she looked like. Now, it was a big organization, and I understand we're all busy, and you don't get to every single employee, but to not have a nurse who'd been at that institution for more than a decade know who their leader was astounding to me because there's many, many ways you can communicate with your staff, right? And so for me, I had great mentorship, great leaders that nurtured me along the way. And the one thing they told me repeatedly was your presence matters. You build trust with your presence. Show up. See what they're doing. Talk talk to them. When you do that, it makes a difference. So for me, presence, right? There was a question here. It said, what would be the best advice you could give young professionals getting into healthcare today to do their best? Come with a full, open heart and mind and be ready to change the world. Don't don't just comply. Ask questions, be curious, push boundaries, make it better, get involved, get on committees, have a voice. Healthcare is beautiful. I couldn't imagine doing anything else. Nursing for me is a calling. This has been a calling for me, and I think when we love what we do, it shows. So I'm hoping you all love Caritas now, because all Caritas is the Latin word for love, and it's really about putting love back into the work that we do. So beautiful.
So beautiful. Thank you so much, Darlene. Absolute pleasure. And I hope everyone goes about the rest of their day in love and in Caritas. Thank you so much. And we'll see you in about 8 minutes for the next session, David Dibble. And we'll see you over there. I put the Zoom link into the chat. Thank you again.
Thank you.
Thank you so much. Bye-bye.
Bye-bye.